everybody, it's Dr. Glenn Krieger. Now, I want to show you something really interesting about sleep disorder breathing. Now, I want you first of all to be very careful of anybody out there, no matter what specialty they're in, who says, I can solve sleep disorders. It's not true. We work as a team, and I am part of a team with speech pathologists, myofunctional therapists, oral surgeon, ENT, pediatricians, general dentists. I work with everybody on a team, and we meet on a regular basis to go through things. So anybody who says, well, I solve sleep disorders, run. We have to be part of a team. And one of the things that makes my approach and practice a little bit unique is that I have a 3D X-ray unit that's very low radiation, so much lower than medical grade 3D, that we can take it without any ill effects on a person, and we do it on most of our new patients. But I want to show you something about our 3D imaging that plays into this team approach that I talk about. So if you come on in and get close to this picture here, this is a traditional 3D X-ray that I've taken. Now, most people are used to seeing a flat picture, but this allows me to see things really well. Now, this young man has teeth coming in, and sure, we're worried about the orthodontics and all. However, this is just part of the picture, because what I'm going to do is that this 3D image can then be extrapolated into something that looks a little bit different, and I'm going to show you what it looks like. So this is a three-dimensional image of this young man, and I can zoom in and out from one side of their mouth, right, all the way around to the other side of their mouth. And this is useful for orthodontics as well. But I want you to notice that this is where the air comes in through the nose. Anything black is empty. And notice how then it comes over to this spot right here. It gets very narrow in that area, and it gets very narrow down here. Well, I want you to notice that that's the area of the adenoids. Now, you've heard of adenoids, and people say, well, we'll just outgrow them. Or an ENT says, let's give them some medicine to make their allergies a little bit better. But you tell me how this young man can sleep at night when he lies down, and all this tissue pushes back over here, and there's literally no place to breathe through the nose, and the throat is very small airway as well. And so this is a great example of where I send a patient to the ear, nose, and throat doctor to look at these adenoids and to make a decision, is there something simple we can do to reduce them in some way, shape, or form? Because ideally, we would like to see this, at least this amount here, be reduced so the air can come in through the nose, down the throat. And this is an area that we can affect with orthodontics to move a jaw forward or back. And you hear everybody talk about expanders, and I want to just show you that we can look forward to the nose from the frontal view here and see what this looks like. But at the end of the day, truthfully, this is just part of the process. So when people say, oh, we're going to do expanders on somebody and that's what we do, that's one tiny piece of the puzzle. This is a person who could have a tongue tie and needs to see a myofunctional therapist to solve that issue rather quickly. Or some sort of nasal surgery or a deviated septum. All of these things I look at when I do my new patient exam. And that's why I'm part of a team. So I'm begging you, if your child snores or wets the bed or sleepwalks or has night terrors or wakes up with stomach aches, which is really acid coming into their throat, or wakes up with messy covers everywhere, or has been diagnosed with ADD and you don't think that diagnosis is necessarily correct and it could be bad sleep that's causing this, if they sleep with their head tipped back and their mouth open, any of these things, I want to see them. And I don't charge for my examinations. And sometimes I refer to the ENT, sometimes I recommend we do things, sometimes we work in concert with people on the team. But the bottom line is, there's an answer out there, and no single human being can solve any of it. So give us a call, 972-899-1465, 972-899-1465, or hit us up at info@kriegersmiles.com. Looking forward to helping you and your child in any way I can. Take care.